Each year, as winter approaches, millions of Americans start feeling tired, moody, or even depressed. Many people call it the wintertime blues, but it may be more than just a case of the blues. Author of Managing Your Depression Through Exercise, Dr. Baxter is here to talk about seasonal affective disorder. We've heard this before, but define it for us. What does it mean?
Well, seasonal affective disorder is really, it can happen not just in the winter, which is interesting. Most people think about it as just the winter, but in the winter, typically it's a lack of energy, a lethargy, depression basically. It can also be in the summer a heightened anxiety where you can't sleep, and so it affects different people differently.
The change of season, the change of pace is causing that for people.
Oh, definitely, and I think some of the statistics speak for what's going on. In the wintertime, there's about 1.4% in Florida who suffer from it, and in Vermont it's 9.7%.
Interesting.
So definitely something with the sun.
Here's what I want to know. We understand that you could go through these cycles of change, and some of that's normal, but how do you know what you're feeling? Your level of moodiness, your level of tiredness is more than usual, and you might need to seek help and talk to a doctor.
I think that's a great question. I think it always boils down to your quality of life, and it's a subjective choice where you're feeling like, I'm really sick and tired of being sick and tired, and that is different for different people. But if you're really struggling to get up, if you're calling in for mental health days a lot, or your eating is off, you're losing weight or gaining weight, you should see a doctor or a therapist too.
I mean, sometimes it could be easy as like, my job sucks, and that's what's cycling in my world, and I'm letting it rule my world.
Right.
Have you ever seen friends check in with friends and say, look, you might need to? I mean, if you see that in somebody, that's hard to suggest, but needed.
I think you want to ask, are you kind of open for some feedback? Because I feel like you're not yourself, and I care about you, and I'm just wondering how things are going.
The numbers that are quoted here of how many people suffer from this are really staggering.
I know.
Well, I mean, we're talking millions.
Yes.
When the seasons change and life changes a little bit, and things go downhill.
Well, and it's important to draw attention to it at this time of the year because you really want to mobilize. I mean, if you're not paying attention to it and then you're sort of getting into a ditch with it, it's harder to get out of it as opposed to, you know what, I need to have a plan, and I need to be willing to just follow this plan because I'm not going to feel like it. As it gets darker out in the morning and darker out in the evening, you just don't feel like it.
No, you don't. You don't. Well, let's talk about some solutions here.
Sure.
The top one on your list, and people don't like to hear it, but it's exercise.
Exactly. My motto is seasonal affective disorder, run for your life. And you don't necessarily need to run, but you definitely want to get your heart rate up and get your muscles moving, because when your muscles contract, they send a chemical to your brain that helps your brain function better. And this has just come out in research over the last 5 to 10 years, so it's fairly new.
Will that work for all people that suffer from this disorder? I mean, what if you have, you think about different people, there has to be different levels of the disorder. So if you're at the higher level, will a doctor say, start with exercise?
Again, it depends on the sort of quality of life, like how bad is it, but always exercise, unless you really can't. I haven't read one research study about exercise and mental health that has said, green light. You always go for it.
But would that be the only
No, not at all. Actually,
I
think that start with exercise and good nutrition, good protein at each meal, and if you're still not getting out of it, you might want to take an antidepressant or go see somebody to get evaluated for that.
We mentioned your book at the beginning, Manage Your Depression Through Exercise. You have a copy right there on the table. What made you want to write that?
Well, I felt like I had this knowledge from working with people in my practice where they do work out while we're talking. And I got to see the changes that took place as opposed to just sitting and talking, and how powerful they felt as they were moving. And I felt like I wanted to put it in writing and get it out in terms of a self-help modality so that people could, if they couldn't afford therapy, they could read it and maybe get motivated, because the book also talks about mental exercises to combat the depression too.
I mean, here's the thing. It sounds so basic, but yet we're still not doing it. So hard for us to do. What's at the root of that?
Well, I think that's another great question. Motivation is critical, and that's comprised of values, confidence, and circumstances. So depression can take your confidence away. So how you set up your circumstances to just exercise, let's say, is what's the next step? Like I tell people, put your workout clothes next to your bed so you trip over them. You know,
there's no excuses. They're right there in front of your face. You've got to do this.
And then, you know, if you value it, just don't pay attention to your feelings. Just be willing. Just be willing to just give it a try, even if it's a 10-minute brisk walk. You know, build on that. And there's an echo effect once you develop some mastery over getting yourself moving.
I think you've touched on something where you said just do 5 minutes, just do 10 minutes, because you think about even like New Year's resolutions where we think, okay, I'm going to have this body by, you know, May, and I'm going to work out like a fiend for an hour. But when you start high, you're going to fail if you do that.
This is true.
So start simple.
And that tends to help with how you value it. It's interesting, the number one reason people lose weight as adults is high school reunions.
Oh yeah.
You know?
That'll scare you into losing weight, right? If anything else is out there, that's one of the things.
Yeah, wanting to look good is certainly a value, that's fair, but how you then create your circumstances to be consistent with it is really important.
These are all good advice.
Yeah.
Dr. Baxter, thanks for joining us.
You're so welcome. Thanks for having me.
Name of the book again, Manage Your Depression Through Exercise. Go get it.